We've talked about the numbers, right? The numbers and the data. We've been focusing on this a lot. That's a big part of this, of course. But another crucial piece, the stories that we continue to hear from our frontline healthcare workers. Joe Paris spoke with ICU staff from St. Alphonsus and St. Luke's today. They tell them things right now, as you probably can guess, as bad as ever. But staff says there are major differences for them from the last time things got this bad back in December.
To put it simply, the situation in ICUs across the Treasure Valley is very serious right now.
I'm a therapist that works in all areas of the hospital, and I had to be pulled from my floor assignment into the intensive care unit just because we had patients coming in and being put on ventilators, and we just were having to pull staff in the most immediate needed areas.
Nancy Roberts is a respiratory therapist with St. Luke's. She was able to step away for a few minutes to talk about the situation they're seeing while working in the ICU. We last checked in with Roberts last fall as Idaho ICUs began to fill up with very sick COVID patients. She says it is just as serious now, but has a different feel.
The younger demographic now that we're seeing coming in and that are needing the intubation and the ventilators and the ventilator management, it seems like 35 to 45 is kind of our really sick patients, whereas the first go round seemed to be more in their 70s. It seemed like, so yeah, it's definitely a different demographic.
Dr. Megan McInerney is the ICU medical director at St. Alphonsus Regional Medical Center in Boise. She says she agrees. Things are just as serious as they were late last year, but it does feel different.
It feels very different to me because it's preventable now. Right. So it's a very different feel as far as the age of the patients who are coming in. They're getting really sick. There are a lot of people on ventilators and they're not vaccinated. So it didn't have to be this way. And so with that, the air in the ICU is a little bit defeated by the nurses, the doctors, the respiratory therapists, the nurse practitioners, physician assistants. All of the members of our team are feeling a little bit more deflated with this round of COVID surge because it's a preventable illness at this point.
In terms of morale, Roberts says the situation is taking a toll, especially on less experienced employees.
It's rough. You leave here having worked a very hard shift and trying to take care of people, and not everybody makes it. So it does, it absolutely can wear you down. And just knowing that, we're having a hard time keeping staff and having new people hire on is also, those are realities. So we just, we're doing what we can do.
I think my concerns as the ICU medical director are less about, are we going to run out of ventilators, but it's more about, are we going to run out of staffing? Are we going to have enough nursing staff to take care of these patients, right? We're already having to set up and line up backup schedules for the physicians, but we just don't have endless amounts of nurses to help take care of these patients.
ICU beds in the Treasure Valley are getting tougher to find, and there is fear that very soon difficult decisions will need to be made.
Currently, we are not turning patients away. I want to keep saying that, right? If somebody has an emergency, if somebody is having an issue that needs to be evaluated, do not hesitate. Please come. We will take care of you. But we're getting pretty worried about the future if we keep going in this direction.
We're seeing a lot of people dying again, which is unfortunate. We're seeing patients that take a turn very quickly. I personally have had patients on our regular floor, and within 2 hours, I'm asking for them to be transferred to the intensive care unit.
It's not like we haven't been here before, Joe. We've heard this message. We've talked to these ICU staff members and these doctors and these nurses. We could tell they've been frustrated before, but here we are again. And so I guess if we have to ask again, what is the message this go round?
Yeah, well, and I just want to say real quickly, this can be very deflating for a lot of hospital employees where they're in such an intense situation inside the ICU or the hospital they're working in, and then they go out in the community, they go to the store, they go to the mall, and people are acting like it's completely normal. Now, they tell me, Brian, that their message to the community is if you can get vaccinated, please do this, because they say they meet so many people in their ICUs that say, I wish I would have gotten vaccinated, but unfortunately they're at the point where it's too late. Another thing that ICU employees have told me today and over the last few weeks, Brian, is they really ask people to wear a mask, whether it's required or recommended or not. They're saying if you're around other people, please wear a mask. We're seeing so much spread of this Delta variant for how contagious it is, and we know the science works, they tell me, Brian.
Yeah, and if you think you're tired of it, you should talk to an ICU nurse. You should talk to hospital staff, and you'll find out how tired COVID can actually be. Thanks, Joe.